Welcome to the Help Me Understand podcast, where we cut through the noise we see on social media to find advice that actually works. Today, I'm so thrilled to have Mary Reddinger with us. Mary is part of a business mastermind group with me and also happens to be the smartest person I know when it comes to pre and postnatal yoga. I invited Mary onto the podcast to discuss the pelvic floor, which interestingly enough was one of the highest requested topics when I surveyed my email list. The pelvic floor, as you can imagine, is a big part of her world working with new moms. So I knew I needed to bring her on to talk about it. You are going to love Mary. In this episode, she breaks down exactly what the pelvic floor is, what its job is, how it works, what dysfunction looks like, and also strategies to improve the health of your pelvic floor through things like breathing, training key muscle groups, and even working with pelvic floor physical therapists. I am so excited to share this conversation with you. There's so much to get into, so let's get started. All right, Mary. Well, it's so good to have you on the podcast today. I'm so excited to get into the topic of pelvic floor dysfunction with you, and I'm so glad you could join me for this and carve out the time in your very busy schedule. So thank you for being here.
Thank you so much for having me, Brenton. I'm excited to be here.
So I figured we would kick this off with how you and I know each other. We have the same business coach, and we've been kind of watching each other's businesses evolve through a mastermind program for the last year and some change. Although, as we just talked about before we hit record, this is actually our first conversation that we're having with each other. And I wanted to have this conversation with you because I see you put all of your stuff in the feedback request channel in Slack. And I know that you have a lot of programs for yoga with prenatal women and for new moms. And what I see you oftentimes talking about in like emails that you're sending to your list or social media posts that you're making is pelvic floor health and dysfunction. So it seems like you focus a lot of your work with new moms in this particular area. And I was wondering if we could start out then with you kind of helping me flesh out a mental picture of what our pelvic floor actually is, because it's a part of my body that I'm not totally certain I don't have like a strong map for it the way that I have a map for my calf or even my foot. And so I don't always know exactly what is being referred to when somebody references the pelvic floor. So in very basic terms, help me understand how to think about what the pelvic floor is.
Absolutely. And you are not alone. Most of us are not taught about our pelvic floor in health class with our healthcare providers. I didn't learn what my pelvic floor was until I had my second baby. Like, nobody was talking about the pelvic floor back when I had my first baby. And I only started learning about my pelvic floor because I was experiencing pelvic floor dysfunction after the birth of my second baby. But the pelvic floor is a group of muscles. It's not one muscle. It's a group of muscles that attach at the bottom of your pelvis. So if you want to visualize, at the bottom of your pelvis, you have your pubic bone at the front and your tailbone at the back. And then your two sit bones, one on the right, one on the left. And you could even, like, if any of you are listening at home and you're sitting down, you could put your hands underneath your pelvis and feel your sitting bones. They're the bony prominences underneath your butt. And your pelvic floor attaches to those 4 bony points at the bottom
Mm-hmm.
of the pelvis. And it creates a sort of wide diamond shape, sort of a hammock structure at the bottom of your pelvis. And the pelvic floor isn't one muscle, it's many muscles. And your pelvic floor is 3 layers of muscle.
3 layers of muscle. Okay. Help me understand those layers and like what they do and why it's important to have those 3 of them in there.
Oh, okay. Well, why don't we actually talk about, let's like circle back a little bit and talk about your pelvic floor's role in your body.
Yes.
Your pelvic floor has many, many important jobs. So, one of the jobs of your pelvic floor is sphincter control.
Mm-hmm.
So, your pelvic floor helps pee, poo, and gas stay in when they need to stay in. And it helps pee, poo, gas, and babies come out when it's time for them to come out. Your pelvic floor also plays a role in stability. So if you think of your tailbone is the bottom of your spine. It's the very bottom of your spine. And some of your pelvic floor muscles attach to the tailbone. So your pelvic floor is attached to your lower back. The pelvic floor helps provide stability in movement for your pelvis and your lower back. The pelvic floor also plays a role in sexual function. So your pelvic floor relaxes to allow penetration to happen, and it contracts for orgasm.
Hmm.
And so your pelvic floor plays a pretty big role in helping sex feel good. Your pelvic floor also, there's a lot of lymph there in the pelvic floor. It's part of your lymphatic system. So I'm not an expert in the lymphatic system, but it has an important role with that.
We've got sphincter control, we've got stability, we've got sexual function, and we've got lymphatic flow. So
Yes. Oh,
moving.
and we have support. So your pelvic floor helps hold your pelvic organs up. So,
That makes sense.
if you have a uterus, helps hold your uterus up, your rectum, your bladder, all those pelvic organs that we have. It helps provide support for those organs so they are not falling out of our body.
That makes complete sense. So that then I can sort of map, okay, 3 layers with this like multitude of jobs that it has. It makes sense that it would need to be many muscles connected to these kind of 4 bony prominences, some of which are on our pelvis and some of which are on our low back, and that there needs to be layers to that whole structure so that it can have the robustness to be the support that we need, but also be flexible enough to keep up with all of the different jobs of the day.
Yes, absolutely. Yeah. And the pelvic floor is many muscles, so we don't have to do a deep dive into the individual muscles of the pelvic floor. Like,
Sure.
we'd be here all day. But a good way to think about it, if you're curious about that, is the more superficial layers of the pelvic floor.
Mm-hmm.
They provide that sphincter control. That's one of their main jobs. And if you think about that, that makes sense because those muscles are the closest to your sphincters.
Absolutely. So by superficial, you mean closest to the skin?
Yes. Mm-hmm.
Yeah. Okay.
Yeah.
Makes complete sense.
And then those deeper layers play more of a role in the support.
That also makes sense. yeah, they're like closer to the organs. They're closer to the center of the body.
Yeah.
So, okay. So what you said, like, you didn't really get into this until after your second baby. You started experiencing some dysfunction at that time. So what are the symptoms and issues of a pelvic floor gone wrong?
Sure. Well, you're looking at issues with the jobs of your pelvic floor. So if we think about that sphincter control, not being able to hold pee, poop, or gas in when you need them to stay in. So things like leaking. Leaking is a very common complaint
I
with
hear that one all the
women,
time.
like any woman who has given birth at some point, but leaking can happen if you haven't given birth.
Mm-hmm.
On the opposite side of that, chronic constipation can be indicative of a pelvic floor issue. Not being able
Fascinating.
to let it out when it's time to come out, or not being able to empty your bladder completely. Also, usually a pelvic floor issue.
Mm-hmm.
Um, yeah, tampons not staying in.
Mm.
Things coming out when it's not time for them to come out. Things staying in when it's time for them to come out. Um, pain with sex. You know, it's time for something to come in. You know, the pelvic floor might not be able to relax completely to allow that to happen without pain.
Mm.
Um, or with support, we might experience a feeling of heaviness in the pelvis, or that can lead to prolapse. And so prolapse is when one of those pelvic organs starts to descend into the vaginal wall.
Mm.
So
How do
like
you know that that's happening?
oh, well, the best way to know is to see a healthcare provider. A doctor, like your OBGYN can probably diagnose, they can diagnose prolapse. But a pelvic floor physical therapist can also diagnose that. But a few things you might experience if you have prolapse is that feeling of heaviness. And often with prolapse, people will describe like it feels like I have an orange trying to come out of my
Mm.
vagina. You can also have rectal prolapse. It's just one of those pelvic organs has descended somewhere it doesn't normally live. So like it feels like I'm sitting on an orange. It feels like something's kind of bulging. A
Mm.
lot of people will describe a bulging sensation, like
Mm-hmm.
something's trying to come out. With prolapse, you can experience leaking, whether
Makes
that's
sense.
urine or feces. Yeah, those are the big indications of prolapse, at least what I hear as a yoga teacher.
Mm-hmm.
Mhm.
Mm. And so also the pelvic floor playing the role in stability of like the low back. And I imagine sort of like the pelvis's relationship with the low back. There's some angle there. Like, does this ever manifest as like musculoskeletal pain in people?
Oh, absolutely. Yeah. So chronic low back pain, that can be an indication of a pelvic floor issue.
Hmm.
And if you've had chronic low back pain and you've tried like many things and it's not getting better, go visit a pelvic floor physical therapist and find out what is happening with your pelvic floor, because it might be a pelvic floor issue. Um, Also, pain in your hips, like chronic pain in your hips, can be an indication of a pelvic floor issue or something that's common. A lot of these things can happen outside of the birthing population, but something that's common with my prenatal students and with postnatal students too is pelvic pain. So pain at your pubic symphysis joint at the front. That is a common issue during pregnancy, and it can linger postpartum or can start postpartum. Usually there's something going on with the pelvic floor. There's usually some sort of imbalance in the pelvic floor muscles that's causing that pain. But that can also look like SI joint pain, which is more toward the back of the pelvic. If we're thinking about the pelvic floor and where it attaches, that's toward the tailbone, the sacrum, SI joint pain. There can be pelvic floor dysfunction that is causing that or contributing to that. And tailbone pain. Tailbone pain is common after birth. It can happen during pregnancy too. I don't find it's as prevalent as pubic symphysis pain or SI joint pain during pregnancy, but tailbone pain can be common postpartum, and usually that's also an imbalance if that's the reason for the tailbone pain. Of course, like with all these things, they can be multifactorial, and could be a pelvic floor issue, likely a pelvic floor issue, but maybe not. But that's why it's always good to see a pelvic floor physical therapist, because they're the people who can they can assess your pelvic floor. They have the skills and the training to do that and then diagnose you. But tailbone pain can be, like, if you haven't had an actual tailbone injury, it can be because one side of the pelvic floor is a little bit tighter than the other, and it's pulling on your tailbone.
Okay, this is starting to form a picture for me, and I definitely want to return to the physical therapist piece of this, because I feel very ignorant in that regard, and it feels like kind of like a newer thing that's been on the scene. But before I jump into that, I'm trying to understand, I guess, are we born with a healthy pelvic floor? And then if we are born with that, what are the milestones or events in our lives or the habits in our lives that's putting us in a place of dysfunction?
That's such a good question. And I have a lot to say about that. So, children can experience pelvic floor dysfunction sometimes. And with children, my understanding is that will often show up as bathroom issues. Like sometimes struggling with potty training, sometimes that can be a pelvic floor issue, or children who are constipated, that can be a pelvic floor issue. Sometimes it's diet, but, if you've tried a lot of things and it's not sticking or it's not working, there are pelvic floor physical therapists who work with children. And it might not be a bad idea to check that out. We actually haven't talked about how your pelvic floor works. We've talked about what it does, but we haven't talked about how it works. Your pelvic floor works with your diaphragm. So if we, again, for listeners, if you visualize your diaphragm is the muscle that runs across the bottom of your rib cage, and it's your breathing muscle. Your pelvic floor is also a diaphragm, and it works in conjunction with your diaphragm. So when you breathe in, your diaphragm contracts down to allow your rib cage to expand and your lungs to fill with air. And then as your diaphragm contracts down, ideally, what is happening is your pelvic floor is lengthening as the diaphragm descends. I'm sure you know this. All muscles need to be able to lengthen to contract. Muscles that are stuck in a contraction, like a low-level contraction all the time, are usually weak, tight muscles. And then we can also get muscles that are locked in a lengthened position. So we breathe in, diaphragm contracts down, the pelvic floor descends, and with that we're getting a lengthening of the pelvic floor muscles. And then with a normal exhale, your pelvic floor lifts back up to its resting position as your diaphragm goes back to its resting position. When our breathing patterns change. Now, often I will say children, if you watch a baby breathe, if you watch young children breathe, they are like really good breathers. As we age, our breathing patterns can change, and we can fall into a few different types of breathing patterns. One is shallow breathing. So people who breathe with their shoulders. Yeah. And you'll see their shoulders move up and down as they breathe. They're getting a little bit of chest. They often get a little bit of chest motion. But they're breathing with their shoulders. And when you're breathing with your shoulders, you're actually not using your breathing muscles to their full capacity. You're using accessory breathing muscles, so muscles that like assist with breathing, but it's not their main job. All the muscles around your neck and your shoulders, they are accessory breathing muscles, but your main breathing muscles are your intercostals in your ribs and your diaphragm. So when we breathe in our shoulders, we're often not getting our breath down into the bottom of the lungs, and our diaphragm isn't fully contracting down. When the diaphragm can't fully contract down, our pelvic floor can't. And so then our pelvic floor isn't getting good movement in that instance. And all muscles need to be able to move well to function well. And so,
Fascinating.
and if we get stuck in that shallow breathing pattern for a long time, that can manifest as like shoulder and neck tightness, but then we can also experience pelvic floor tightness because the pelvic floor isn't getting that lengthening. And then another breathing pattern is reverse breathing. I'm sure you've seen this because you're a yoga teacher. People who inhale and suck their belly in and exhale and their belly expands. It actually should move the opposite way. When you breathe in, as the ribs expand, there's a natural expansion of the belly muscles. And then as you exhale, as the air empties, that comes from the bottom up. So your pelvic floor lifts to its resting position, the belly softens, and the ribs soften.
Interesting.
Yeah.
I'm doing the reverse breathing right now, and it feels so foreign to me, but I could see how I could get into a pattern of it where I don't even realize I'm doing it, and that's just how I'm breathing. So follow up on the diaphragm, because I have a pretty good sensory awareness of my diaphragm. I can feel when it's moving, but I've yet to feel really physically the lifting and lowering, the contract and release of the pelvic floor in conjunction with my diaphragm. I think it's just my brain is less used to probing that area and pulling out sensory details and making sense of it. So I'm curious. Well, I want to hear your follow up to that, if that brings up any thoughts for you. But I'm also curious, like if I'm using my diaphragm 3-dimensionally and I can feel that in my body, I can feel I'm not really using my accessory muscles for breathing so much. I can feel those finger-like muscles between my ribs, the intercostals, sort of swelling open 3-dimensionally on my inhale and contracting back into center on my exhale. Is it safe to assume that my pelvic floor is going along for that ride in a functional way? Or could my
Absolutely.
Okay,
Yeah.
so they really do function together, and the health of one system directly impacts the health of the other.
Yeah, absolutely. It's a lot of us are, those pelvic floor muscles are subtle, and some of them are deep within the body. And they can be hard to feel because we haven't been trained to feel them. You can train yourself to feel the movement of your pelvic floor. But if you are breathing well, and you're not having any pelvic floor symptoms, it's safe to assume your pelvic floor is probably happy and doing exactly what it's supposed to be doing. Now, if you are breathing well and you're experiencing symptoms, then again, I would encourage you to book an appointment with a pelvic floor PT and see what's happening. But yeah, breathing. And that's one of the first things I work on. Breathing is a foundation of my prenatal classes. It's a big part of postpartum recovery. It's one of the first things you should do, and you can do it like right away. You can start to work on your breathing. We can talk a little bit more about how pregnancy affects your body and how that affects your breathing in particular in a second. And if any of my students are dealing with pelvic floor dysfunction, whether or not they have given birth, that is one of the first things we work on, is reestablishing. We call it 360 breathing. So you want your breathing not to just expand your front ribs, but also your side ribs and your back ribs. I do want to talk about one more breathing pattern that can show up.
Please do.
Belly breathing. And if you watch people breathe, sometimes what you see is when they breathe in and out, that breathing bypasses the ribs. You don't see any rib cage movement, but it all like really balloons forcefully into the belly as they inhale. And what that can do is put a lot of pressure down on your pelvic floor. And so we haven't talked about this too much, but your pelvic floor also helps you manage pressure in your body. And that's why it's tied to your breathing, or you know, these are all tied together. It works with your breathing. It helps your body manage pressure. When we are ballooning our breath into the belly, especially if we're doing that over a long period of time, it can put a lot of pressure down on the pelvic floor, leading to weakness in the pelvic floor muscles. A tight pelvic floor is also a weak pelvic floor, though, because if muscles aren't moving well, they're not getting a good lengthening. They can't contract well either. So they're both weak.
Yes. So I think where we had kind of sidebar here is in looking at where things go wrong for the pelvic floor in our modern life. And you alluded to, or you talked a little bit about the fact that it's not even just adults who are dealing with this. Sometimes it's kids who are dealing with it. And typically, if you watch like really small children, they're so great at this 360 breathing that you've been talking about. And I don't know exactly what it is. Maybe it's like our physical habits and patterns. We're spending more time on screens and less time playing outdoors as kids. But like, what are sort of like the markers along the way that just make it more difficult for our pelvic floor to be functioning the right way?
Sure. So the breathing is one. Pregnancy affects your breathing. At some point during pregnancy, you're not going to be able to get a good 360-degree breath because you have a human and your organs have all shifted up and they press up on the diaphragm and flatten out the diaphragm. So it can't, when your diaphragm flattens out, it can't contract down very well. But what I do in my prenatal classes, we fight for that 360-degree breath for as long as we can.
I love it.
When we can't anymore, we know our body's doing exactly what it's supposed to do. And then we work on it postpartum. But because we lose it during pregnancy, it's really important to work on reestablishing that breathing postpartum. A few other things that can affect your pelvic floor is your posture and muscle imbalances. So, which sometimes go hand in hand.
Yeah.
So, and what we do in day-to-day modern life can affect our posture. So some common patterns, and again, I'm saying this as common patterns because there are always people who don't fall inside these lines. And I'm not saying, I don't want people to come away from this and like try to micromanage their posture and find the perfect posture. But if you're stuck in a certain posture, so what's really common during pregnancy, that, you know, this is the population I work with, is students get stuck in an anterior pelvic tilt. which is normal because all that weight at your front is pulling your belly and pulling your pelvis forward. It can be hard to resist that. But if you think about how your pelvic floor attaches at the bottom of your pelvis, that's putting the pelvic floor in a certain position.
Mm-hmm.
And it might get stuck there. And some people get stuck in anterior pelvic tilt postpartum if they were stuck there during pregnancy.
That makes sense. I mean, I feel like I'm stuck there as a human. My entire like movement practice is sort of geared towards getting things to consolidate more in the front of my body and like get my front ribs to move towards my front pelvis points and just feeling like that kind of lock in more. And then subsequently, what reinforces that is getting the breath more into my lower back ribs. So I can feel if I can get my breath into my lower back ribs, that means I've done a good job consolidating my core on the front of my body, typically.
Yeah, absolutely. And the big thing is that, like, I see students during pregnancy and postpartum, or even, like adults who've never given birth, who are stuck in a posture and they can't get out of it. And all their movements, all the yoga poses they do, their
Yes.
pelvis can't move. And that if your pelvis is stuck, your low back is usually stuck too. And then we need to work on that. We need to work on that mobility and getting the low back to move and find other positions. Help your pelvis be able to find other positions. Get your hips moving without your pelvis, hip mobility, getting your pelvis moving over your hips without moving your hips. Like all this stuff helps with a healthy pelvic floor, healthy low back. So we don't need to have perfect posture all the time, but if you can't get out of the posture you live in and you're experiencing symptoms, then like as a yoga teacher, as a private yoga teacher, my postnatal classes are really small group. If I notice you can't get out of that, we're going to work on that. What's going to help you? And sometimes that's release techniques, and sometimes that's strengthening the antagonist muscles, and, looking at a whole body picture. So when you're in an anterior pelvic tilt, you also usually have lengthened low belly muscles.
Mm-hmm.
And your pelvic floor works with your low belly muscles to provide that stability. And so you might not have that stability. And sometimes in movement, what that looks like is like when I do ab work, all I feel is my lower back, because your lower back is contracted all the time.
Totally.
And that can also, if somebody's having symptoms with that anterior pelvic tilt, that can look like hip pain. Sometimes leaking can be accompanied by that, painful sex. And it can create, that anterior pelvic tilt can create a lot of tightness at the front of your pelvic floor. And so something else I see often is people with pubic symphysis pain often have that anterior pelvic tilt.
Interesting. I mean, I can imagine like if you take like a cup of soda and you like kind of tip it forward a little bit, like not that the soda's tipping out of the cup, but it just kind of shifts the angle of the soda in the cup. There's more soda now at the front of the cup than at the back of the cup. So like that's more, I would think, pressure and weight and substance that's now like resting on the front of my pelvic floor. So the front of the pelvic floor has a bigger job to do, and the back is not getting enough of a job. And so if I'm like repeating this every single day, and to your point, if I'm stuck there and I'm not then subsequently moving my pelvis in a different direction to get to load it in a different way, and doing that in all of the ways, all of the potentialities that my hips can move and my low back can move, then it might at some point produce some symptoms of like, yeah, my pubic symphysis is now painful or something like that.
Yeah, absolutely. Everything's so connected. And we can get the opposite of people who are stuck in a posterior pelvic tilt. They're often gripping their deep hip rotators, and some of those deep hip rotators are very close to the pelvic floor, and a few of them, like some, and sometimes this depends on who you talk to, but your obturator internus is a pelvic floor muscle, and some people consider the piriformis part of the pelvic floor too. And so what some people start doing, especially if they're like a butt gripper and their tailbone is always tucked under, they're actually using those deep hip rotators instead of their glutes. And they can get a lot of back pelvic floor tightness because now those muscles are clenching and trying to do the work of the glutes. The glutes aren't working. Your glutes also really help you. So there are pelvic floor helpers, like your abdominal muscles help your pelvic floor. Your glutes help your pelvic floor. And if there's, so sometimes posture can be the thing. And then like rib flare can also,
yes.
and that's coming at pregnancy widens your rib cage. And depending on what you're doing in your movement practice postpartum, or if like you don't know that and you haven't worked on it, sometimes the rib cage can stay wide or flared. And then that affects the movement of our diaphragm, which can in turn affect the pelvic floor. The rib flare also affects the abdominal muscles, and you can have these like one-sided differences between the abdominal muscles when there's a rib flare. And so getting everything like balanced and working together. So posture. So it can start with the posture, and our muscles help our bones hold their positions. So then we have to look at the muscles and what's going on. And a few things I do, because I'm not a pelvic floor physical therapist, so it is not within my scope of practice, nor within like my realm of knowledge to diagnose a pelvic floor issues. There's a few things, like I know enough about the pelvic floor, I can get some ideas of what's going on in your pelvic floor, but a pelvic floor physical therapist can physically like touch, they can do internal work to find out what's going on in your pelvic floor, what's tight, what's weak, what's going on there. Maybe it's perfectly fine. But if I have a student with pelvic floor, what sounds like pelvic floor dysfunction symptoms, or if I know they have pelvic floor dysfunction symptoms, we work on the breathing, we work on abdominals and find out, like, do your external obliques want to do all the work of the abdominal muscles? Okay, then we need to get the lower TAs working. We need to get them on board. As on the right side is the internal oblique wanting to jump in for everything. And then how can we get that balanced? And, like, how are those muscles showing up for movement? And is there an imbalance there? Then can we, in yoga, work on creating balance across the abdominal wall? Your glutes also help. They help with low back stability. And a lot of us have weak glutes because we do a lot of sitting. Working on glute strength. And so something that can happen too, I guess we didn't talk about this. I mean, the pelvic floor is just, I can go on and on about the pelvic floor.
It's a wide landscape.
It's a wide landscape. When your abdominal muscles or your glutes aren't showing up for your day-to-day life or your movement the way they are supposed to, the way we want them to, your body is so smart. Your body is so smart and resilient, and your body will find a way to do things. It's not maybe always the most efficient way, but it will find a way. And so if your glutes and your abdominal muscles aren't kind of showing up the way we want them to, your pelvic floor can take over, and your pelvic floor will say, I can do this. But your pelvic floor it works in tandem with the glutes. It works in tandem with the abdominal muscles, but it's not meant to do the work of your glutes. I mean, those are big. I mean, your glute max, big, powerful, dense muscles. The pelvic floor, these are smaller muscles, and they're not meant to do the work of your glutes. Your glutes are supposed to do the work of your glutes.
Yeah.
your abdominal muscles are meant to do the work of your abdominal muscles. Then, so if those things aren't doing their job, your pelvic floor might say, I can do this. And then your pelvic floor is overworked. And like what will happen when the pelvic floor is like, I can do it, it can get grippy and tight because it's like, I can do that stability. But then over time, if that's the only muscle providing stability to your pelvis and lower back, well, it's going to get weak because it's tight. And then that can lead, it can start out as tight and then lead to something like prolapse because it gets weakened.
Mm. You were mentioning something about working on ab work, and you mentioned about do the external obliques want to do all the work, then we need to bring the lower abdominal, the transverse abdominal more online. These are like very nuanced experiences that for one, like I have not always been like personally really effective at like feeling out those nuances internally. And this is just such a nuanced area of breathing and pelvic floor. These are like the subtle things that almost like people don't even want to pay attention to because they aren't like the flashy, sexy things. It's sort of like, I'll only pay attention to this when something starts going wrong. So, how do you go about helping somebody who's experiencing these things in these like very subtle ways where you're trying to identify, is the wrong part of your abdomen working? Are your hips not working? What are the things that you either look for or test for, or you ask people to pay attention to so that they can start to identify whether they have these issues going on?
Sure. And I have to say this comes from experience and training that I do pay attention to these things. And um the yoga classes I teach, like my postnatal class, 8 students max. So I can really watch them and ask them questions and see what's going on. And my private students, it's just, me and them. And it's very conversational. So we can ask these questions. But, a way I might look at this is I'd have a student do a crunch. Keep your sacrum steady on the floor. We're not tipping or rocking on the sacrum. Interlace your fingers behind the back of your skull, elbows up so the neck is really supported. We're trying to do everything we can not to let the neck jump in, and then exhale and lift. I usually give them a block to squeeze. And then what do you feel? And some people will feel their upper abs. They'll feel the abs around their ribs. So we're kind of in that external oblique area, and they won't feel their low belly. And then we experiment if that's what's happening. What happens if you give that block a little bit more of a squeeze? Because those adductor muscles, those are also, adductors are they share fascial connections with your pelvic floor. The lower abdominal muscles share fascial connections with the pelvic floor. So when we engage the inner thighs, that can help engage everything from the bottom up. Well, okay, like what if you give that block a little bit more of a hug? Oh, now I feel it in my low belly. Okay. All right. So then we know, well, that's what we need to do. We need to get those inner thighs a little more on board for them to feel those lower abs come on. And we might work with that principle. Or maybe it's repeating it a few times and like building that brain and muscle connection. Or maybe, there's just like a lot of different things I might look at. And like if we're doing a crunch with a little twist, what do you feel there? Do they feel the same on both sides? Rotation is so important for the health of your pelvic floor. Rotation, so twisting, can help improve your rib cage mobility, which then can help you get that 360-degree breathing. So then if there's, okay, what do you feel when you twist to the right versus what happens when you twist to the left? Like, what are they feeling? What can they articulate to me that they experience? Is one side harder than the other? Do they feel a difference? Do I see a difference? they're on the floor in a supine twist, if they go to the left, is their right shoulder blade way off the floor versus if we did on the other side and their knees were to the left and their right arm was out, is that right shoulder blade pretty close to the floor? Like, what am I noticing there? And then again, with my role as a yoga teacher, I can't diagnose and I can't fix, but I can help them create more balance through these muscle groups. Does that make sense? Am I making the things I'm looking at?
Yeah,
Yeah.
you are. I mean, I appreciate the sort of the approach to inquire about these things of where am I feeling this, and it almost sounds like, okay, if I'm going to do just like a basic crunch, I'm looking for everything to be online. I'm not looking for anything to be like the superstar of the show, and I'm not looking for anything to be just completely absent from the game. But I want like my six-pack muscle up here that's like kind of pulling my ribs down. I want my lower abdominals that's like creating that stability for my sacrum on the floor. And then I want everything that like wraps around me to feel like this sort of like hug in and this like boost up off the floor. And if I'm feeling that, then I can make some assumptions that the pressure that I'm creating for my pelvic floor, for my diaphragm, is probably within like a healthy, supportive range. And that's probably something I want to be repeating more often than not so that my brain starts to connect, make all of these connections, and that becomes like a more natural way for my brain to use my body rather than whatever way I walked into the yoga session with.
Yeah, absolutely. Yeah. And there's something I want to say about that too. When we were talking about, I mean, there's still so much more I could say about what leads to pelvic floor dysfunction. But like if we're talking about ab work, what a lot of people do because they weren't taught and they don't usually know they're doing it. Again, your body will find the strategy that's working that day or what's working. But they push out. So if they do a crunch, we'll
Yes.
see them push out into their abs rather than
Mm-hmm.
gathering in. And like rewinding, your pelvic floor works in conjunction with your lower abs. So we want that contraction to come from the bottom up. A good abdominal contraction actually starts with the pelvic floor. And that's actually, we didn't talk about this, that's an active lift. And that's when we're looking at like stability for the pelvic floor, is that's when we're lifting through all three layers of the pelvic floor. And that's helping provide stability for the lower back. And that's helping us manage pressure. So when we push out into our abs for a crunch, then we're putting a lot of pressure down on the pelvic floor. Which
Okay.
then
I
when we
just had
talk
to
about
breathe
pressure,
out for a
that can lead
second.
to weakness if we're getting pressure down all the time. You know, if you do that once, if you do it a few times, like that's not a problem. And, you know, I'm not a strength coach. There are debates in the strength training world, though. I listen to these things about whether or not like you should push out into a weight belt or not. And people have differing opinions on that. But, you know, like for a crunch, if you do that a few times like that, that's not going to be a problem. But then over time, and then you start experiencing pelvic floor symptoms, well, then that's something we want to look at. We need a different strategy for doing that. So we're not putting as much pressure down on your pelvic floor. We're leaning into that support that the pelvic floor can provide.
Mm. Okay, so you said something there that just kind of made my insides squirm up a little bit, which was like the active lift, because now I'm starting to think Kegels and I'm starting to think of these like pelvic floor exercises that I'm not really sure that I've ever gotten right because I don't really know how to validate that. Um, Help me understand like how what do you help somebody with in terms of like the actual pelvic floor itself, like whatever. I mean, we've talked a little bit around that, like restoring breathing, restoring different movement mechanics so that we're not stuck in various positions, but we're kind of also flirting the line here between what you can help someone with as a yoga teacher versus what somebody would want to go see a physical therapist for.
Mm-hmm.
So what's the difference between that, and what could you expect to work on in a class with you versus like when would you refer someone out and what would they work on with that physical therapist?
Sure. So if you're experiencing any of the pelvic floor symptoms I talked about, my suggestion is not to go to me first, is to go to
Yeah.
a pelvic floor physical therapist. And I do want to make that differentiation. You want to see a pelvic floor physical therapist because they have done special training to help them be so they can do internal work. So and they might, that sounds scary to some people, and that is okay. I've been in pelvic floor physical therapy, and I will say my pelvic floor physical therapist waited a couple weeks before we actually did internal work. So they're going to build that trust relationship with you. And pelvic floor physical therapists can do their work without going internal. But an internal assessment can really clue the pelvic floor physical therapist into what is happening in your pelvic floor, what is tight, what is weak. And, also like if you have prolapse, where are things right now? And there's different grades of prolapse. So where are we starting from? And then how can we improve that? So I really encourage my prenatal folks during pregnancy, see a pelvic floor physical therapist and find out where your pelvic floor is now.
Hmm.
And then also you have that relationship established so you can see them postpartum. I wish our country was different with this. In other countries, pelvic floor physical therapy is a standard part of postpartum care. It's what you do. I wish that was a standard of care in our country. But you should see a postpartum, or you should see a pelvic floor physical therapist when you're postpartum. Because birth, during birth, your pelvic floor, if you give birth vaginally, your pelvic floor lengthens to allow that baby to come out.
Mm-hmm.
And that can affect your pelvic floor postpartum. And
Mm-hmm.
if you don't do the work to help your pelvic floor heal postpartum, it might not go back to normal on its own. Like some of the things that we experience during pregnancy don't go back to normal on their own postpartum unless you work on it. And then also, like if you have tears, if you have a fourth degree tear, though, that means the tear went into your pelvic floor muscles.
Mm.
And then you can get adhesions and scar tissue, and that can affect the function of your pelvic floor. And then if you have a C-section, that impacts your pelvic floor because they're cutting into your abdominal tissue. And then that heals and you can get scar tissue. And then, the pelvic floor works so closely with the abdominal muscles that you can get pelvic floor dysfunction. And C-section, folks who have had a C-section are actually at a very similar risk of leaking as somebody who gave birth vaginally.
Oh, fascinating.
Yeah.
I had no
Mhm.
idea.
Yeah.
Hmm.
So it's just really important because I can't go internal, and even if I could, I wouldn't know what was happening, but I don't want to. So, um, and then a part of your therapy for pelvic floor physical therapy, it might be release work. They might need to do some internal release work. For me, that was part of my healing, was doing manual work on my pelvic floor to get those muscles to release. And then they'll probably give you some exercises to do.
Mm-hmm.
It'll probably be some breathing.
Mm-hmm.
And depending on your pelvic floor issue, it might be Kegels. But
Yes.
Kegels are not appropriate for everybody all the time. If your pelvic floor has a tendency to be hypertonic, so that's like another word for tight, it doesn't want to relax and lengthen.
Yep.
Kegels can reinforce that and make it worse.
That makes sense because
Mhm.
you're kind of contracting an already tight muscle.
Right. Yeah. Yeah. Now Kegels might be a part of your healing if your pelvic floor is weak. So that's, if you feel heaviness in your pelvic floor, prolapse is is usually in combination with weak pelvic floor muscles. Kegels might be a part of your healing. Now, what I do as a yoga teacher, so Kegels might not be for you. And the best person to tell you that is your pelvic floor physical therapist. And then the other thing I'll say, and why I really encourage pelvic floor physical therapy, is leaking can be due to tightness. Those pelvic floor muscles aren't relaxing to let all the urine out. And then later you're leaking because your bladder wasn't empty. It can be a timing issue. It's just like your pelvic floor isn't quite getting the timing right when you're sitting on the toilet. And you can work with a pelvic floor physical therapist on that. Leaking can also be due to weakness. A lot of people hear leaking and they think my pelvic floor is weak. Leaking can be associated with tightness. A tampon not staying in can be due to a weak pelvic floor, but it could also be due to a tight pelvic floor. A constipation, again, weak or tight. So you don't know unless you see a person who is trained, like a pelvic floor physical therapist. There's also pelvic floor occupational therapists. They do the same thing as a pelvic floor physical therapist. So you need
What's the difference?
My understanding is they have the same training. An occupational therapist, though, might work with you a little more on like your day-to-day movement.
Oh, interesting.
They are
Okay.
qualified to give you an internal assessment. They are qualified to give you exercises to do. So then your pelvic floor understands what's going on. And again, even if you're not doing internal work, they will be able to make a much more accurate assessment of your pelvic floor than, a postpartum movement teacher can. And then they might give you some exercises to work on at home if there's some sort of muscular imbalance you need to work on. Now, for me, my pelvic floor was tight, particularly on the right side. It was like really tight. That right side didn't want to let go. So we can have one-sided issues too. Like you can be tight on one side and weak on the other side. Or we talked about pelvic positioning and how that can create an imbalance front to back in your pelvic floor. So those professionals can give you the full picture. And now what I can do as a yoga teacher with my postpartum students, with my prenatal students, if they're seeing a pelvic floor physical therapist, I'll say, what are you working on? What do they want you doing? And then I can look at that and turn that into something that, is a little more yoga-ish and maybe a little more fun, because a lot of people don't have fun going home and doing their physical therapy exercises. And we're incorporating those movements into their yoga practice. So they're doing the work outside of the sessions. So, and that can really help us with our healing, is doing that work outside of the sessions where we're working on breathing, we're working on strengthening the glutes. Or for like people with a tight pelvic floor, I didn't go back to this. My pelvic floor was very tight. And so my exercises were just breathing and like gentle hip openers because hip openers can help open the pelvic floor. But I did have to ask my physical therapist, because I was like, at that point in my yoga journey, I was putting my leg behind my head and I was like, I think I need you to define what gentle means.
Totally.
Yeah.
And so how did you know you were getting better from, like, how did you know the breathing and the gentle hip openers were working?
Well, I stopped leaking as much. So what was happening for me, I was leaking because I was tight. And then what would happen for me, I would go to the bathroom. I would stand up to wash my hands. And then as I was washing my hands, I would feel a little dribble down my leg. So that started getting better, because I wasn't leaking. I wasn't getting those dribbles. And I was also experiencing urgency. Urgency can be indicative of a pelvic floor issue too, is like feeling like you have to go to the bathroom all the time. You have to go after you just went. You feel like you won't make it in time, or you don't make it in time. Those are or leaking when you jump, leaking when you run. Those are all within the realm of urgency issues. So
Mm-hmm.
I was having to go to the bathroom very often throughout the day. And when I had to go, I feel like all the time, even though I was going like way more often than I should, I always felt like I wouldn't make it in time.
Hmm.
And so that started to get better. I could hold it comfortably longer. I wasn't going to the bathroom as much. And then also sex started to feel really good. Like sex didn't feel
Mm.
terrible before that, but like I was like, "Oh, I get why people really love this."
Interesting.
Sex started to feel better. Um and like it actually felt really good. And that's how I knew I was getting better. So
So if sex started to feel better for you than it had before, even like before pregnancy, then like clearly like the pelvic floor tightness pre-existed the pregnancy, perhaps,
Mhm.
but it wasn't at a problematic enough threshold to be causing these other issues. And so maybe it's just like, oh, this is just how sex is for me. But then, just kidding, I start having these other issues. Now I solve those other issues, and sex is a whole new game.
Yeah. Yeah. And that like sex shouldn't hurt. Sex shouldn't hurt. And I did have issues with painful sex before my
Mm,
first and
yeah.
after my first. Actually, I had really painful sex after my first. And I just didn't know. That was my first pregnancy. Nobody talked to me about my pelvic floor. I was just like, oh, I guess this is how sex feels after you have a baby. It hurts.
Mm,
And I didn't know. Um, and I'll say too, your pelvic floor, there's a lot of nerves in your pelvic floor, and your pelvic floor responds. It's tied to your nervous system. So often, like for me, I still am a person who struggles with anxiety. It's something I've worked on, but back when I had my first baby, that wasn't something I worked on. And I imagine my pelvic floor was probably tight. I don't know that
mm.
for sure, but it was probably tight before I got pregnant with my first baby. And then it tightened up even more after I gave birth to him. And that anxiety was causing it to grip and hold on. Um, and so something then I work on as a yoga teacher with my students who have a tight pelvic floor is we often work on hip opening and deep breathing and hip opening, but then also sometimes meditation, or just like I'll try to find the things that make them feel really good and relaxed, whether that's a restorative
Hmm.
pose or a certain breathing technique or a meditation, just to get their nervous system to down regulate, because that can be so helpful for the pelvic floor, is just getting out of that flight, fight, or freeze mode.
Totally. I'm glad you brought up the psychological component of it because when you initially were talking about, dysfunction in that area, so much of it seemed physical. And then we kind of got to like, well, sex might be painful. And immediately my brain goes into like, there's like a psychological aspect of that because I also have a history of painful sex. And
Mm-hmm.
a lot of that came from sort of like psychological elements, I think. I mean, it's hard to really know what's going on inside of you, right? But um, I'm glad that we're sort of fleshing out this picture that it's also like this the state of mind is also going to have an impact on how all of those beautiful babies are doing down there in their little hammock.
Mm-hmm. Mm-hmm. Yeah. Yeah. So yeah, a pelvic floor can, give the diagnosis. They'll know exactly what's going on in your pelvic floor. They can tell you whether you need Kegels or whether you don't need Kegels, or sometimes you only need Kegels in specific situations. That was also the case for me. Like Kegels were for a specific thing. Um, but then a movement teacher who has undergone training in pelvic floor health or, pre-postnatal stuff, then what we can do is reinforce what you're doing in pelvic floor physical therapy. We can keep it up. I have a private student I work with who hasn't given birth, and she had pelvic floor tightness. She hired me as she knew she was graduating pelvic floor physical therapy because she really didn't want to go back to where she was. She was having recurring UTIs, or the feeling.
Oof.
So like a feeling of having a UTI, but then like the tests are coming back negative. That usually means that's usually a pelvic floor tightness thing.
Oof.
And so we still work together because she just really wants to maintain that health in her pelvic floor. So for her, like she always gets a long Shavasana because she loves Shavasana. And when I first started working with her, her glutes and her abs were pretty weak. So it was and I actually spoke to her physical therapist on the phone. I usually do that if my students are in pelvic floor physical therapy or they're graduating pelvic floor physical therapy. I'll see if I can get in touch. I mean, they have to sign something that tells their pelvic floor physical therapist they can talk to me. I'll say, what do you want me to work on with them? And then I start incorporating that into the private sessions or into the postpartum classes.
I love that.
We're keeping up with that.
How long does it take for somebody to graduate pelvic floor physical therapy?
Oh gosh, it depends. It really depends on how quickly your body adapts. That's really unique to everybody. So I can't
Makes sense.
say that. There's been such a wide variation with my students. I mean, some go for like 6 weeks. I was in pelvic floor physical therapy for a year, and I actually didn't officially graduate when I had to stop going because COVID happened. And then we moved to a different state, and I wasn't going, but I was doing much better at that point, and I was only going to the pelvic floor physical therapist once a month versus when I first started, I was going once a week. So it just can be very different for everybody based off of where you started and how quickly your body responds to those adaptations. And I do find for a lot of people, menopause can also, like women who go through menopause, then we have another like big hormonal change. And that can affect your pelvic floor. So some women find during menopause, they'll start experiencing pelvic floor dysfunction, or they'll have a recurrence of pelvic floor dysfunction that they had earlier. And then you go back.
Interesting.
You go
Okay,
back to
because
pelvic floor physical therapy. You work with a movement teacher who understands what's happening in your body, and you work on it again.
I love that. That is interesting because when I was planning for this whole podcast series, I sent out a survey to my list. And the population I work with are more people in midlife who are getting fit for the first time. So not so much new moms. But the survey I sent out had, 20 different topics on it. And pelvic floor dysfunction was like the top first or second choice. And I was wondering, are these most likely issues from previous childbirth that were just not dealt with? Or even like issues that predated childbirth, maybe from like childhood, let's say? Or is there something specific to being in midlife around that menopausal area that can also trigger some dysfunction in the pelvic floor?
Yeah.
So it sounds like you're saying like the hormonal shifts can either, it can exacerbate issues that have always been there. It can flare up an issue that was resolved, but bring it back. And potentially it could maybe even turn something that was not, it was benign. It was like, maybe it was a hint of a problem, but there was no symptoms yet. Maybe it can start to bring some symptoms into play.
Yeah. Yeah. My understanding is too, sometimes menopause can cause a pelvic floor issue that
Out of
wasn't there
nowhere.
before.
Okay.
Yeah. Yeah.
Fascinating. So way back at the beginning of this conversation, you mentioned something like, we don't get educated on this. And I always love kind of thinking about the perfect world. And I don't know if you've given much thought to this, but I want to put it out to you. In your perfect world, how would we learn about the pelvic floor throughout the course of our life?
I think we would start getting pelvic floor education in health class. Men have a pelvic floor too, and a male pelvic floor is not much different from a female pelvic floor. Men don't go through some of the same hormonal changes. Pregnancy, postpartum are another big, women have like a lot of big hormonal changes throughout their life, but males have pelvic floor and males can have pelvic floor dysfunction. I can't cite the source, but like I read that 1 in 10 men have pelvic floor dysfunction. And that can look like urinary issues. That can look like sexual health issues, like erectile dysfunction can be a male pelvic floor issue. So we'd be getting that in health class in like 5th grade. When I think in 5th grade, for me, it was 5th grade when we got like the sex talk. And like that would be
like the
part of that.
initial one. Yeah. There was like maybe 3 times throughout school. I remember like 5th grade and then like an 8th grade and then like a 10th grade or something like that.
Yeah. Yeah. And so that would be a part of health class. Is like, what is a pelvic floor? How does it work? Why is it important for sexual health? How do we know something's wrong with our pelvic floor? And then for women, it would be part of, or people who are giving birth, I should say, birthing people, it would be part of birth education classes too. Like, this is what happens to your pelvic floor during pregnancy. Your breathing gets shallow, your pelvic floor is not getting good movement. There's a lot of pressure on your pelvic floor. So it's not getting good movement and there's a lot of pressure. And then you give birth and it like lengthens so much more than it does in day-to-day life. And then so postpartum, there might be some stuff going on. Here are some things you should look out for. And in an ideal world, pelvic floor physical therapy would be a standard part of postpartum care, just as you go to your doctor for your checkup. I do want to say, for anybody who's listening to this who falls into that birthing category or wondered why their doctor didn't talk to them about this, your OBGYN or your midwife at your postpartum checkup is not assessing your muscle function. They do a pelvic exam, but they're checking you for usually cervical cancer. They're making sure your uterus is shrinking back to its normal size. They're making sure any stitches are healing. They're doing important things, but they're not assessing the muscle function of your pelvic floor. And they're not assessing the muscle function of your abdominals, and they're not checking your pressure management. So that like this would also be a part of that postpartum care. And then maybe even to a standard part of perimenopausal care. Just that we're like learning about this through our life. And
I love that.
Yeah. It's so important for everybody to know and to understand their pelvic floor.
I really love that. So if you could wrap up maybe 3 big takeaways for listeners, like what are the 3 main things people can start doing today to enhance their pelvic floor health?
Sure. Number 1, work on your breathing.
Love it.
Yeah, and I love using hands. One of my favorite ways to teach that 360-degree rib expansion is to lie on your side, and you can like really curl up there. Like really have your knees in toward your chest if that's comfortable for you. Like make sure your head is supported with like a pillow or a yoga block, and if your hip doesn't feel good on the floor, like pat up your hip so you're comfortable, and then you make a lobster claw with your hands and you put that on so thumb in the back, your other 4 fingers in front, because you have ribs in the back too. So your thumb is in contact with the back, like that middle place between your thumb and your index finger is in contact with the side ribs, and your other 4 fingers are in the front. And you just breathe down into your hand. So on your inhale, you feel your hand gently lifting up toward the ceiling. And then exhale, your hand softens. And if you're breathing that way, your belly is doing exactly what it's supposed to do. Your pelvic floor is doing exactly what it's supposed to do. And then making sure that your glutes and abdominal muscles are strong.
Love it.
They are working to help provide you with stability when you need them to provide stability. And finally, not being afraid. Like, don't be afraid to get help if you have any of those symptoms. I mean, I listed so many things. There are so many things that can be indicative of a pelvic floor issue. Be your own advocate and go get it. Like, and most places in the United States, you don't have to have a referral to see a pelvic floor physical therapist. There are a few states where you have to have a referral, and there's a few states where you need a referral to get it covered by insurance. But most states, you don't need a referral at all. Go be an advocate for yourself. I mean, if your doctor says you're leaking, that's normal. It's because you've had 3 babies. Like, be an advocate for yourself and say, no, I want to see if I can do something about this. Because then when we're leaking and sex is painful and our hip hurts all the time and we feel heaviness at the bottom of the pelvis, then our nervous system, that usually affects our feelings about ourselves. And then our nervous system gets upset. And so, like, you deserve, you don't have to live with those symptoms, and you deserve to get help. That's what I'll leave
That's
people
so
with.
beautiful. I love that. That's so beautiful. Yeah, you deserve to get help. For sure, 100%. Oh my gosh, we've been talking for over an hour, and I feel like we've barely scratched the surface of what we could get into. So I'm sure we'll have to schedule a follow-up to go down some more nuances and some deeper rabbit holes. To leave listeners with like a few parting things, do you have any helpful resources that you recommend if people want to learn more about their pelvic floor?
Absolutely. I have a blog on my website, maryredingeryoga.com, and I have some blog posts about pelvic floor. There's also a few really good accounts on Instagram. I'm on Instagram. I post sometimes about pelvic floor stuff. The Vagina Whisperer. She is a pelvic floor physical therapist. She has great resources available. I'll send you a list of some social media blogs, free accounts where you can get some free information.
I would love that. My favorite thing in life is turning my Instagram feed into just one big educational scroll. So I'm excited about fleshing out my pelvic floor gurus on Instagram. Well, and if listeners, you mentioned also like your blog, which I'm excited to send listeners to. If anybody wanted to work with you, what population do you work with, and how would they start that conversation with you?
Sure. So I work with prenatal students. Right now, I teach in person. I live in Chapel Hill, North Carolina. I also work with postnatal students. I love postnatal. That is such a fun class to teach. And I teach an 8-week series for postnatal folks, and I run that about 3 or 4 times a year. So it's not always open. But you can visit my website, www.maryredingeryoga.com, and you can find out when the next classes are happening, or follow me on Instagram. I usually let people know when the doors are opening for that series. And that's a virtual class, so you can join me from anywhere. And I've had people from all over the country join that class. I keep it really small, only 8 students, so I'm really giving you personalized attention and feedback. And then if you don't fall into that birthing category, I work with private students, and I work with private students virtually. And most of my private students, not all of them, but most of them are sorting through some pelvic floor stuff. And if you're interested in privates, you can email me. You can send me a DM, or on my website, there's a contact form for private lessons. And if you fill out that form, I'll get back to you. We'll schedule a free consultation to see if we're a good fit.
Amazing. Well, Mary, I've learned so much. I need to go process everything that I learned and digest it all. I'm just so thankful for you taking the time to have this conversation with me and share all of this knowledge. And I'm just so looking forward to the next time we can hop on and continue the discussion.
Me too. Thank you so much for having me, Brenton.
Absolutely. It's been a joy.
Alrighty, my friend. That wraps up our conversation with Mary Reddinger. I hope you found it as insightful as I did. We covered so much today, from what the pelvic floor is to how to keep it healthy. And personally, I loved that the health of the pelvic floor depends on how we're breathing, using key muscle groups like the glutes and the abs. For me, that really reinforced the way we practice yoga at Yoga in Your Living Room and gave me the confidence that we're already doing all the right things on the mat to support the long-term health of our pelvic floor, even without us doing anything specifically for the pelvic floor. If you enjoyed this episode, please take a moment to subscribe, rate, leave a review, all of the good stuff that podcasters always ask you for. But truly, your feedback helps us reach more people who could benefit from these discussions. And on top of that, if you have any questions or topics or guests you'd like us to cover in future episodes, just drop me a message wherever you can find me. Social media, through our website, reply to one of my emails, text me, call me, do all of the things. And mostly, thank you so much for tuning in to the Help Me Understand podcast. Until next time, take care and keep moving well.